start. Okay, we were just waiting for a few other people, but on the basis that we're quorate, we will make a start. One of the key people I was waiting for, Hannah, welcome. Just so that you know who I am Mike Bell. I'm the chair of the Integrated Care Board, and I'm co-chair of the Integrated Care Partnership, along with my colleague Andreas, who will be taking over halfway through the meeting. So I'll kick off the meeting, and a big welcome to this session today. I'm going to start off with other welcomes because I'd really like to welcome our new ICB Chief Executive, Katie Fisher, and I'd also like to welcome Hannah Doody, our Local Authority Chief Executive Representative. This is the first South West London ICP meeting, so that's really exciting. I'm also going to make what I think of as a sad announcement, because she has been a colleague of mine for the best part of a decade. This is Gillian Norton's final meeting as she's leaving St George's and Epsom St Helier Trust, where she's chair of both of those organisations at the end of this month. So your final meeting, Gillian. Thank you very, very much for your work on the ICP, but more importantly, the support that the work that you've done over the years and the support you've personally given me. So thank you. Just a quick reminder that this meeting is being broadcast online and it is being recorded. There are hundreds of people joining the call as we speak now, and the recording will be uploaded onto the ICP website after this meeting, and a version with British Sign Language will also be produced and uploaded. Because of this, can I please ask that all members use microphones when speaking? That allows us to pick up the recording for the website, but also make sure that should anybody be hard of hearing, it will link to our hearing loop. So if anybody is hard of hearing, a hearing loop is available. Point of order, this is a meeting held in public. It's not a public meeting, but there will be opportunities for questions at the end from any members of the public who wish to make them. I've had apologies for this meeting. I've had Councillor Piers Allen, Joe Farrer, Ian Dodds, Councillor Graham Henderson, Brenda Scanlon, Asad Mushtaq, Imran Chowdhury, Douglas Flint, and that's so far all of them. But as you can see, there are a few people that we're expecting to join us during the course of the meeting. I'd also like to welcome our colleagues who will be joining us and making various presentations during the course of the meeting. So a big welcome to you, and we look forward to hearing from you as we move forward. The meeting is quorate, but I'm not anticipating we're making any decisions that need quoracy during the course of the meeting. Declarations of interest, there is a register that's available on the website. Could I just check with colleagues that there are no additional interests that people need to declare? No, fine, thank you very much. If we could look at the minutes of the previous meeting, which was held on the 4th of December last year, are people content to approve those minutes? Thank you very much. So we'll now move on to our first substantive item. And as I think all of you know, we have, as an integrated care partnership, placed workforce in South West London, both health, social care, and indeed our voluntary sector partners that support it, as a key priority. We've had an investment fund which has undertaken a range of initiatives, and we have begun to much better coordinate our work between those three core sectors in developing our future strategy to deliver our plans for South West London. Really pleased to welcome Larissa Page, our Chief People Officer at South West London, and she's going to speak to this item, and she'll also, if I may, Larissa, get you to introduce the people that are going to join you for the various presentations, because this is actually a really exciting part of the agenda, because we have with us real live examples of the projects that have been run by our funding, and and just be able to hear what a big difference they've made. So Larissa, over to you.
Thank you very much. So previously, when we've presented on this particular programme of work, it's been my co-lead, Sam Mason from South London Partnership. So you've got me today, I'm afraid, updating on where we are so far. So as has been said, 80% of the ICP funding was allocated to the workforce project. It's been in train for some time now. It closes the 25th of March, I don't know what I was going to say that. It closes in March the 25th, so at the end of this month. We've been working together over that time and just we've got lots of different partners that have worked together. So some of that time was spent understanding the needs of some of those different project areas and just thinking about how we can align our best efforts. So really conscious about not bombarding people in the community and working in a way that made sense to them. We've been updated on progress throughout that period of time through highlight reports, and we have spent some time focusing on some of the challenges that different projects have experienced and really thinking about how we can unblock and mitigate some of those issues that have encountered. And I'll come back to some of those issues later on. We've also had times when we've come together in person. So we've had 2 workshops where we've been able to really do a lot of sharing of learning and thinking about unblocking those issues, but also mindful about how do we move to sustainability at the end of the projects. We are looking to review progress at the close down, so sharing the evaluation of those different programmes in May, and we can bring that to you later in the year. Oh, thank you. Oh, I've got to do this as well. Oh dear, this will be interesting. Okay. So I'm joined here by 4 programme areas or project areas that we particularly wanted to showcase today. So Reza, actually would you like to introduce yourselves? You have to press the button when you do that.
Hello, good afternoon everyone. My name is Raisa Chowdhury. I've been the project lead for a project for the South London Careers Hub as part of this funding.
Good afternoon, everyone. My name is Zema Guimarães. I'm the head of research at the University of Roehampton. For the purposes of this meeting, I've been leading on the ICANN program for over the last 15 months.
Hi, everyone. I'm Melanie Ashdown from Integrated Care Support Services, and we've delivered the Community Upskilling and Job Readiness Program. Thank you.
Hi, everyone. I'm Zara Safra. I'm the head of South West London Training Hubs, and we've been delivering the Hard to Recruit program.
And I'm Dave Williams. I've been supporting Zara as part of the internationally educated nursing element, which we'll talk about after.
Thank you very much. Today I'm going to share with you some of the other projects and more importantly, some of the successes that we've been able to achieve throughout this time. So I'll start with so 24 internationally educated nurses that were working in care homes as care workers have been supported to achieve their NMC registration. And you're going to hear about that particularly today, and that's one that's really exciting. Actually, I saw a picture of 7 of the internationally educated nurses, and just seeing that picture of them really brings home the great work that's been done. It really has a significant impact on people living and working in South West London. We also have 260 health and care workers in the NHS, so really a real focus on social mobility, so supporting some of our more junior members of staff in terms of salary, entry-level roles, supporting them to complete training courses that will improve their ability to develop and grow in the organisation, stay in South West London, but more importantly, work their way up into more higher banded posts. 3,700 individuals have we've engaged with through schools, colleges, universities, job fairs and events, particularly showcasing NHS jobs. We've supported 20 people, I think it's actually more now, to undertake project-based work experience. And I emphasise the project because we want people to be able to come away with something they can really talk about at the end of that, not having made teas and coffees or being at the photocopier, but actually something they can meaningfully put on their application forms, and that was in the primary care setting. 6 of those have secured job. Actually, that's probably changed as well now since this was written. So, yeah, thank you, Sarah. 8 people have secured jobs in primary care as a result of that particular project. Also, South West London and St George's, so our mental health provider in South West London, held an event. 170 people from the community attended, 93 of which were recommended for jobs within that organisation. So that's a really fantastic outcome. 31 care leavers, so I'm looking to you, Jose, have been supported, so through this programme and also others as well, in terms of further training and access to jobs in health and care, social care. And 500 school and college students engaged in 60 employer encounters in health and social care. So that's managers, staff, clinical staff, in coming to different events to speak about the NHS and health as a potential career choice. So enough from me for now. I think it's time to hear from some of our projects that we're showcasing today. I'm going to come to you first, Melanie. Thank you.
Down. Right. Thank you. Thanks for having me. By way of introduction, Integrated Care Support Services is an independent not-for-profit based in Wandsworth, but we work across South West London. We started in 2014 working mainly with primary care, supporting recruitment, retention, but for the last 2 years we've been working more closely with VCSEs. And this project, Community Upskilling and Job Readiness, focuses on tackling our system-wide workforce challenges. So to kick off, would work. Oh, there we go. So why this project? We wanted to reach ordinary people, help the everyday people, not people in primary care, not people in hospitals, but we wanted to reach everyone else and help them gain specific skills to work in health and social care. But we wanted to bring learning to poorly served communities, support access to training, which is normally afforded to staff that work in primary care. Reaching different geographies, people with caring responsibilities, people with disabilities, those with time and travel and cost constraints. And how we did this was by delivering bite-sized online sessions at different times, including in the evenings. The group sizes meant that a conversation could be had with the individuals. It wasn't just delivering training as well. We wanted to raise awareness of roles in health and social care, demystify and myth bust the preconceptions that many people have about working in healthcare, particularly around the needing a degree or really thinking it's just out of reach for themselves. And we wanted to promote local employments for local people and strengthen those place-based relationships between health and VCS in particular. So what we did, we had 2 parts to our project. We broke it into 2 parts. Part 1 was community sessions. Those are sessions that we delivered with our VCSE partners, so one from each place. They were co-designed and co-delivered with the VCSEs. And part 2 was specific training, so job readiness training. So the reason we did it in that order, part 1 was to generate some interest in those jobs, to myth bust about those jobs. We had guest speakers attending, talking about this is what it's like to be a social prescriber, this is what I used to do, really bringing it to life. And we have some great examples from individuals who then went on to secure a job. One lady worked in Tesco, she had disabilities, and then she became a social prescribing link worker. Really good testament to hear those stories at those sessions. So those community sessions provided an introduction to working in health and social care. We focused on South West London. So part 1 of what is South West London? So it's the 6 boroughs. We spoke about the language that we use in the NHS. What is CCG? What is ICP? What is STP? What is ICP? You know, making that make sense for individuals. Really simple to understand. Types of roles, where to find jobs, and also we covered volunteering as a route to work experience. So this might be just boosting the volunteering aspect and actually connecting it to potentially a job as well. And then the VCS who were chairing that meeting with us then spoke about how they can support. So it was jointly delivered. We had a target to reach 300 people. We actually only had 167. And I would say that's because this is the first time we did it. We set ourselves ambitious targets, and it's actually a useful baseline now for future for us to know the number of attendees. Part 2, job readiness training, we delivered basic medical terminology awareness, care certificate awareness, health literacy, mental health awareness, unconscious bias, CV prep, preparing for interview, time management, things like that. We had a target of 384, but we boosted that. We went to 570 to date, up to February, had attended. So that is, in summary, the 2 parts of that project. These are some of the partners we worked with in the delivery. And secrets of success, I think this might be my last slide. The secrets of success, why this project has worked quite well, we shared that funding. So the funding that we received for this project was delivered with the partners. Everyone in that supply chain was part of the delivery, received that funding. Joint delivery with each VCS in each place. The user experience was really important to us. So based on feedback, we didn't just do online bookings. We were taking phone calls from people who didn't want to book online and making those bookings for them. The power of paper. We printed the flyers that had all the training and distributed those into the ICB, into libraries, into Morrison's down the road, through all of our delivery partners. Social Care Academy Hub, in particular, thank you. The Carer Hubs, Work Match in Wandsworth were key in supporting the communications and using the informal networks as well. Besides the standard stuff, social media, we also used WhatsApp groups that we have with social prescribers and practice managers and making every contact count. So some of the work we do, we deliver training in care homes, so ensuring that we are getting that training out as far as wide as we can. And it helped build those VCSE relationships where we have free support that we give them, we have shared values, and we support partner delivery events. So this really helped us reach a wider audience than normal. And then the feedback slide, I'm going to just skip over that. You've got that in your pack to say thank you, and it was a great project. I think that is the end. Thank you. Happy to take any questions now or later. Yes, sorry, last one. Bid sustainability. Okay, what next? We're looking at bids and partnership opportunities if there's anyone interested. We're chasing innovation. We want to be different and do different. And so one of the things we're exploring is the use of gaming, the gaming environment to 16 to 24-year-olds to connect them to jobs, to provide basic training through the gaming environment. Signposting and redirecting to adult skills provision links into one of our other projects that we're doing for the GLA, working really closely with Wandsworth Lifelong Learning. All the video recordings and resources are on our website, so accessible beyond the life of this project. And issuing digital badges and digital certificates to people who attend our training for their portfolios. Thank you. That is the end.
Thank you, Mel. I'll hand over to Jose. Thank you.
Larissa, do you want to take questions now?
Would you prefer to do that? Or we can wait to the very end?
Yeah, I might just, if I take a couple of questions, just because people might lose the questions if we leave it too long. I think, Gillian.
Thank you, Mike. Thank you very much. Really interesting. I enjoyed reading the pack. Thanks for all the work you've been doing. In this particular project, do you have any data as to how many people have ended up in employment in health and social care? Thank you.
We've got anecdotal information from individuals who've come to us, and some of them we now use in our delivery because they are good advocates. So, for example, the community sessions in the evening. We're at the moment, we're gathering data as an evaluation from our key stakeholders, but also people who attended, because that number includes people that have attended courses from April. This program started in April last year. So we're doing another evaluation now to gather information on that. But, I mean, the feedback's been amazing, so, yeah.
So at this stage, sorry, Mike, may I? We don't really have any idea about... It's clearly been successful in terms of input, but
Yes.
we don't know how successful it's been in terms of outcomes.
We don't. We're doing that evaluation right now.
Okay.
Thank you.
Thanks very much.
Thank you.
And that evaluation will come back to the partnership board. Yvette.
Thank you. And thank you for the presentation. Excellent work. It was similar to Gillian, actually. I was just wondering where in the place-based system some of that activity that you're doing is showing rewards, and how that information will come back to Croydon, for example. And also, I think you mentioned you're doing work with St George's Mental Health Trust. We are, of course, in Croydon with South London and Maudsley, and I wondered whether work was actually going on with South London and Maudsley as well. Thank you.
I didn't say that, but
That was me.
but we are connected to them in other ways. Yes. Yeah. Was that your project? Yes.
Not mine specifically, but I can respond to that. No, we're not doing any work directly with SLAM, so it was just with South West London, St George's. The emphasis at this time has been focused within South West London. However, we are starting to potentially look towards doing work across the whole of South London, in which case it would do going forwards, but more to come on that.
I think back to you, Larissa.
And over to Jose, thank you.
Okay, thank you very much. I hope you can all hear me. I'm famous for being a very loud individual, so I'm very excited with the fact that I have a microphone. I hope you don't regret this. Let's see. So the ICANN project, which started with an acronym that probably during the duration of the project developed way beyond what the acronym meant, was designed to support care experienced young adults, age 18 to 29, to progress into a potential career in healthcare or further education with the initial focus. We had the initial focus on the nursing associate apprenticeship pathway, but as we started getting our learners started developing beyond that. We started getting people that are now saying that they want to be heart surgeons or want to progress careers that are completely different or might not be that interested in healthcare anymore or are trying to explore everything and anything. So that developed from that stage. Our scope of what we're trying to understand is if we provide the care and support to a group in our society that is so often amongst the most disadvantaged groups that we have, it's possible that in the future they will be offering the same support and care to the communities that they serve. And that was part of that starting point. We looked into addressing, or the entire program has been designed to address the three main challenges that we understand care experienced young adults face when trying to progress into further education and to, in certain extent, to the jobs that come after that. There is the lack of qualifications to be able to get into university. There will be challenges with finances, and even when the first two are there, the pathway to university is not always clear, and there's a lack of information, or at some points too much information about the multiple pathways to progress into higher education. We know that there was a need to level the playing field here because what research seems to indicate is that only about 13% of care experienced young adults progress into higher education when compared to over 40% of their non-care experienced counterparts within the same age ranges. So we designed the program to address these three challenges. There you go. So we target the first one, the lack of qualifications, through creating a bespoke short course for 8-week short course, which had a focus on functional skills, looking particularly into nursing as a career, but exploring beyond that, trying to provide them with an idea of what it would be to work within the healthcare sector, but also what being at the university would look like, which is something that so many of them thought was out of reach. So we had no requirement on any qualification to enroll in this course. The only thing that we were looking for was, one, being a care experienced young adult, but also within the interviews that we had with them, a clear demonstration of their interest to progress into a career in healthcare, or why healthcare was one of the paths that they would consider. We try to mitigate the financial challenge as much as possible through paying them to learn. So a considerable part of the investment that was made into this project was going back into the ones that needed it the most. And so we would cover the time that they invested themselves into the program and all their travel and subsistence costs during those 8 weeks. And we are going over the challenge with access to higher education through supporting them through the University of Roehampton, through guiding them through the process on campus with the support of multiple different teams. This was packaged within with a number of other different things, including career talks, presentations from potential employers, mental health supports when necessary, building from our well-being team, apart from dedicated support from our dedicated ICANN team across the entire project. We launched in May, and we had our first cohort starting a month after, and completing in August with 11. Oops, sorry, this seems to be with 11 learners completing that program. 3 started healthcare assistant positions within the Royal Hospital for Neurodisability, which has been one of our key partners. The opportunity to progress into higher education has been offered to everyone. We had our second cohort starting in January, which encompassed 22 individuals. Our first taster session after our launch in May had a total of 2 individuals in the room, and so getting to 22 at the end of this, going through the entire program, or 33 in the total, was something that we were very proud of. They had their last session last week, so that they have now completed their participation, and we are looking to supporting towards the next steps, including progressing into higher education. So we will be sharing, we are conducting the final assessment, so we'll be sharing all the results and all of our findings very soon, but I want to share just some of our initial insights, which is this model seems to work, a model that is designed to directly target the challenges that one of the most disadvantaged groups in our society has. And at the same time, you try to have a team in place which provides dedicated one-to-one support, so you address both the general and the individual. You level the playing field and you start building to unlock the potential that that community has. We are looking to what ICANN 2.0 would look like. There's many avenues for this. What would be to run a program that is of wider geography, what would be to run a program that has something that is not just focused on one particular sector or profession. And I think we can achieve that through having the 3 components that made this a success in this round.
Jose, I'm going to say, I know you love having the microphone. I'm going to have to ask you.
Sorry, absolutely. So having an educational partner which has a focus on widening participation, as we have at the University of Roehampton, having the employers involved in setting up what the agenda and the objectives and the key areas of need are, and we can work with them to make sure that there's fair employability opportunities for our learners at the end, and having all these partners contributing towards funding this program, which, as you can attest through the brief testimonies that we have at the back, has the potential of changing lives. Thank you.
Thank you, Jose.
Jose, thank you very, very much. And I think really important project as far as care experienced young adults go. Also, I think really important for us because 18 months ago we said one of our ambitions as an integrated care partnership was actually to build really meaningful partnerships with our universities in South West London, and this is a really good example of how we can progress that. Clearly, many of our local authorities have supporting care leavers or care experienced young adults as priorities. I'm actually looking sort of at Vet and Annette at this point on the basis that your borough has the highest number of young people in care, so presumably a very high number of care experienced young adults within its population. Annette, did you want to?
Yeah, because we've also had young people that came in through the Home Office, unaccompanied minors that would have come up, and they're now young adults. I'm actually delighted to see this actually here in this forum, because as a corporate parent, supporting these young people that are coming through the system to achieve and to set our standards high. And, if you're a parent, you want the best for your young people. And it is the young people, and they are the users of our health services as well. So we've really got to set our standards high. It would be really good, out of the 33, across all boroughs, it would be good to see where they came from. Was there a mix of across South West London, the 6 boroughs, or was there targeted? Because Roehampton it's quite difficult. If you're in Croydon, it's how you get there. So it's, you know, the travel for young people as well.
Absolutely. So, curiously enough, the biggest sort of recruitment area was Croydon. So most of the learners that we ended up having was from Croydon, with the second one being Wandsworth. At the end, we had people from all over London, including far North London, and it came out of the partnerships that we developed with the Care Liver Covenants and other wider London groups who have been advertising everything that we were doing, which really expanded the reach. It also tells us a lot about the commitment of these learners, that if they are willing to travel all the way from the other side of London, and I go to Roehampton every day, I live in Wandsworth, Roehampton's on the other side of Wandsworth, I know that it's hard to get there. So just that level of commitment, it is impressive, and it tells us something about what this program can achieve.
Brilliant, thank you. Larissa, back to you.
Just
Sorry, can I bring Peter in?
Thank you, Mike. I would really like to applaud what you're doing. I've had the experience for about 10 years of being a foster carer, and I know, partly because of how many funerals I've had to attend, just how bad the outcomes can be when people are given a label and they're not given a chance, and the low expectations that lots of people in all sorts of systems, including education, had. I was astonished on one occasion where one of our young lads was very, very bright, but his teachers saw him as a child in care. When his IQ was measured, it was off the scale. He should be running the country, and yet he wasn't challenged and tested and encouraged in the way that he should have been, and it was really hard work to get him to lift his eyes and see what he was capable of. So I think what you're doing is great. Like Gillian, I'd like to see the outcomes, because, you know, the key question is, does it work? But even trying is so very important, and I applaud what you've done.
And I'll go to Elaine.
Thank you, Mike. We've just, in our directorate, obviously, safeguarding team is in our directorate. We've just successfully employed 3 care leavers for our 3 teams. They're really excited to have the opportunity to work in healthcare. The teams supporting them have been pushing each other out of the way to want to support these individuals so that they're successful, and parent them and support them into getting into the work environment. So that's something we're really excited about, and we'll support them, and hopefully they'll stay with us and go on a journey.
Thank you for sharing that, Elaine. I was just going to also add that ICANN, brilliant programme. There's a number of other projects that are also focused on care leavers and other underrepresented groups. I think the point to reference in relation to that is that we need to change our approach to support these people, not expect them to work with our very rigid existing ways of accessing employment. And that's why that particular piece of work was a success, because we changed our approach. Purposes of time, I'm going to move you on to Riza, please.
Thank you. We're going a little bit in age order from adults to 18 to 24, and I've worked on a project to do with the under 18. So just a reminder, I'm Riza Chowdhury. I was the project lead for the South London Careers Hub, Careers Uncovered Health and Care project. The Careers Hub works with 103 schools and colleges across the region, and our purpose is to improve careers education. So we work with those schools as well as local employers and partners to really make sure that young people are learning about the different careers out there. So our aims were threefold. The main aim and the most important was to increase students' engagement with the health and care sector and understand the careers that are out there through meaningful experiences, and I'll explain what that means a little bit later. We also wanted to engage our educators to make sure that they were brought up to speed with the landscape of the health and care sector. And we also wanted to create school and employer links, which is essentially what the Careers Hub is built to do, and which we managed to do successfully through this project. So in terms of achievements, we've had 60 encounters either delivered or booked in through this project across our schools and colleges. It's now 700 students that have taken part so far in an encounter, and 34 schools who have taken part. Almost half of them took part in more than one encounter, which means they booked in more than one encounter through this project, which shows that they had a level of trust in the high quality level of experiences that we were delivering for their students. We've also had a really lovely engagement, a strong engagement of collaboration through a lot of outreach from our team. So we worked with the South West London NHS Recruitment Hub, who delivered brilliant workshops in our schools, and with the voluntary sector as well, Age UK Merton, Journey to Healthcare, which is a brilliant CIC set up by a medical student who's been going into our schools, and lots of other kind of community partners who have supported this project. So for our meaningful experiences, as you can see, we had a number of different types of encounters. I'm just going to focus on two here. Firstly, our workplace visits. The majority of those were for SEND students and small groups of SEND students who went into workplaces and were able to hear about the variety of job roles that are available. They were able to interact with service users when they went into care homes, for example, and it just meant they got a more quality experience going into that visit, which is specifically designed for them. And the second one I wanted to mention was that we managed to collaborate with 2 universities to put on visits for around 200 students across 4 visits, visiting their simulation suite. So these incredible mock hospital wards, which really give students an idea of what it's like to work in the healthcare sector. So that was with Roehampton and with LSBU Croydon, and they've been a really great success so far. We've got a couple more to go. Alongside these experiences, I also wanted to mention that we commissioned TikTok videos. I have never been on TikTok, I don't understand it, but our students do, and we do have to meet the young people where they are, and where they're getting their information from is from social media. So these videos have been brilliant. There's been 3 with 3 different NHS apprenticeships, apprentices showcasing what they do in a day. We had 940,000 views a couple of weeks ago, so it's probably more around 1 million views. But more than the views, so the top performing post was an occupational therapist apprenticeship who received 600,000 views alone. But more than that, the traffic on the website increased by 300%. You can see 3,000 people saved that post, which shows that the interest is there. There is follow through, it's not just views that we're looking at. Alongside these experiences for our young people, we also put on an event for our educators. So we had 21 educators across 17 different schools and colleges attend. And the main thing I really wanted to mention about this event was that 100% of them said that they felt more able to support their students in health and care careers after the end of the event. And that's because we had a brilliant array of speakers from across NHS trusts and departments who gave them very valuable information. So overall, it's been a really lovely, successful project. I think the biggest highlight for me is just seeing how much of the students have fed back to me saying they've heard of careers now that they had never heard of before, that they would now consider, especially in things like allied health roles and care roles as well, which they would not have really seen before. And just to finish, just looking ahead, so I've been able to build up and develop employer relationships which will continue through the Careers Hub. So there's that legacy piece there, which is really nice to see. A few of these employers have said to me they wanted to access schools, but they didn't know how to. So this has been a really good way for us to link them with schools in their local area. And that's why the Careers Hub is there essentially to make sure those schools are reaching employers and vice versa. We'll be collaborating with the Kingston and Richmond NHS Trust with a pilot summer event that they're hosting and creating more TikTok videos with them, with their apprenticeships, which we're really looking forward to. And finally, we're commissioning a video to showcase all the successes of the project. Thank you.
Really great, that's really uplifting. Thank you for that. Any questions on that one? Lovely. Okay, we'll move on, Larissa.
I'll hand you over to Zara and Dave, please.
Hi everyone, thank you for having us today. So we are the South West London Training Hub. The South West London Training Hub has a 5-year contract with NHS England to deliver primary care retention, workforce development, attraction and CPD and upskilling for general practice across South West London. We're in our 3rd year of our contract with NHS England at the moment. The project that we've been working on is the hard to recruit people. I don't think the title actually does it justice, so I'm going to try and not read to the slides because you've got them all in your packs. For us, this project encompasses everything I've described. It's attracting people into primary care, it's recruiting, it's retaining, it's upskilling, it's working with all our partners across the board. And uniquely, it actually covers all the ages that we've talked about today, so that's been really interesting. Our aim is to ensure that we focused on general practice nurses, and there was a reason for that. There you go. So, you will have no doubt, undoubtedly heard, workforce is always a chart that never kind of goes up. It kind of always goes this way. I think the challenge I face in South West London in particular is that when I'm shown London and national data, we come up green. And I try and tell people that we're not green, we're all just different shades of red across the country. We're all facing very different workforce crises. So although our nursing numbers might not look as awful as Tower Hamlets at the moment, actually 49% of our nurses in primary care are 55 aged and over, and we don't have the same amount coming through. So linked into that, we wanted to do a qualitative piece of work with them. This is about sustainability. What can we do moving forward with our aging nursing workforce? We've had over 60% response rate from this survey, which actually shows their amplified voice, and they want to be heard. And one of the projects we're now thinking about is actually how do we use our legacy nurses moving forward as they move into flexible working across primary care. Linking in with that, so then thinking actually how do we get new nurses into primary care? And this is something the training hubs have been working on for over a decade since training hubs came into inception. This doesn't want to click. We have been working with universities across London for a number of years, not just for student nurse placements. We work across all professionals, but we focused on student nurses. Reason for that. So when you are doing your degree, you are not always encouraged to go and get a placement in primary care or community. And you often go and get a placement in acute. Human nature being when you then come out of that university placement, you are likely to Google jobs in those places. What we wanted to do was give people that opportunity to have placements and to have exposure into primary care. There are challenges that come with that. We know estates is a challenge. Linked into that, training hubs also approve learning environments across South West London. We're on 80%. So we know our practices are really on board. And it actually encourages retention, because what we have is we have our educators in the system who love that part of their job. So we're increasing educators. We're giving students the chance to have exposure to primary care and community care, which they wouldn't usually have. And I think what has been wonderful about this, we've placed 100 student nurses. I won't be able to tell you how many of them got recruited, because we'll only know once they've finished their placements and they come out on the other side of their degree. But I think this is something we never ever give huge attention to, because it actually happens before people get into their working lives. But it's hugely important. It's pipeline. Actually, if we don't have educators and we don't have learning environments and we aren't giving students the exposure to the right environments, we're just never going to attract the right people into those settings. I will let Dave talk about the international nurses, but one of the last ones we were working on was the healthcare support workers. And again, it's a part of the workforce we often feel doesn't always get the attention it deserves, hugely valued part of the workforce. We've trained over 260 healthcare support workers, and the bigger picture behind that number being it's retention of that workforce, it's upskilling for that workforce, and actually it's developing a career pathway that doesn't always exist for them. What was brilliant about that, we were able to do that across primary and social care. And that was just brilliant, which actually showed the overlapping learning needs and actually how can we be doing this better across the systems. And I will hand over to Dave, because he'll do it far more justice on the international nurses.
Thank you. I won't use the slides. As you can see, I've had one eye retire and one that's not doing so well. So the Internationally Educated Nursing Project was taking individuals that have chosen South West London as their place to live. These will be individuals that have trained as nurses in their native countries, then moved to South West London. The NHS is really, really good at taking internationally educated nurses. The one aspect that sometimes is a significant issue is when these educated nurses from other countries go into social care. So social care organisations don't necessarily utilise some of the threads that can be used to get individuals onto the NMC register and fill those nursing vacancies that we're seeing as a dramatic issue, particularly in social care at the moment. So this project was to take 24 individuals. We had over 70 valid requests through our admissions process, but we had far more than that. We had people from other parts of the country, all that sort of aspect. We've taken 24 through the process of taking them through what's called OSCE training, education in terms of English, and then getting them through their exam stages. We've got the first cohort that have gone through their exams, and we've got the second cohort that are finishing at Kingston Hospital at the moment, going through their simulation to sort of get their skills up to then go and be examined to go onto the register. It's not an easy process. It has about a 40% fail rate. It's a really, really hard exam because, as obviously the NMC have significant regulations about making sure that people are competent, and it's taking that through, and we're also providing some resits. The one thing that we have done is exceeded the 24. We've gone over that to make sure that we've directed people to other areas and other skills that they've required to sort of get ready to sort of take that NMC pathway. The one thing that we did that was a significant success with this project is we challenged some of the thinking that the NMC had and CQC in relation to the what's called the ICP route. So this is where employers can support staff that are care assistants themselves now to get signed off as competent with their English without having to go through an exam. There was an element of, there was a blind spot that they didn't necessarily take into account when that was first developed. They're now changing that practice. Unfortunately, it missed our project, so we couldn't utilise it, but they've taken our work and will actually change the ICP route as it moves forward. So for us, it was a significant move forward, and happy to take questions in relation to those, but I know that you've got a packed agenda. So
we have, but I think people may well want to ask some questions. Dave, I have a question which I'm not expecting an answer, but I would hope that we could have something in the evaluation. So there is a question about sort of average age of the internationally educated nurses that we train. I'd like the evaluation to capture an estimate of the number of working years that we'll get, rather than just the number of nurses that we get. If they're all 55, we don't get very many years. If they're 35, actually that is worth a huge amount to us, and it would certainly change the value for money calculation that we may be able to make longer term. You may have the answer now, Dave.
I do. So I'll give a rounder figure when we do the evaluation, but majority of the individuals that have been taken forward for the OSCE training are around 26 to 38. So there's a significant work life still to have with those individuals that will transfer over onto the NMC register and then bolster up. They've already got roles within their care homes because that was part of the registration process, and then those nurses will go on to work within South West London social care areas.
So that's fantastic. Much better than I'd hoped, and much better than I'd feared. And on the healthcare support worker programme, which I think is also really exciting, one of the challenges that I know have happened in other parts of London and in other parts of the country through programmes like this is the consequence for the practices, because with the additional skills, the individuals are entitled to salary uplifts, and there can be some reluctance from our practice partners to actually support participation where there's a financial consequence for them. Is that an issue for us?
Didn't face it with this one. We do face it with lots of other things, but with these particular individuals we didn't. It was upskilling. They don't usually get a chance to get any CPD in a structured way.
It's a great programme. Thank you. Any other questions before I pass on to the rest of the... Yep. I'll go to Anne and then to Andreas.
Mine was more of a general, well, a comment and a general question. I just wanted to endorse the words that Larissa had about the community careers event that we had at South West London and St George's, which was hugely successful and a really important part of us being an anchor institution, but also part of reducing the stigma of mental health by encouraging the community into our hospitals. And for the first time, we actually have a pipeline of people wanting to come and work for us, which is really fantastic. But my question is on all these sound like really great projects, but they're all coming to an end this month and then subject to evaluation, which obviously I applaud. But I wonder whether there's a risk of us losing some expertise, knowledge, momentum in effectively stopping them before we make a decision on what next.
I'll ask Larissa to say what next actually, as she sums up this part. But can I just check, Nick, did I see your hand go up? I thought I did, yeah.
Thanks. Yeah, some fantastic programmes. I was going to ask a similar question about what next. Yeah, this is for you, Zara. Primary care nursing is a challenge across South West London. I'm a GP and I see it day to day, and many of my practice colleagues really struggle with this. And in Kingston, we've done a lot of work with placements of undergraduates in all healthcare undergraduate professionals, so particularly nursing, but paramedic, pharmacy, others. One of the challenges we've had in primary care nursing is when they come out with their degree, they're essentially not really trained up to work in practices. They don't have a lot of the skills that we need. Primary care nursing can be a more isolated role, that people have to have more autonomy and supervision obviously is possible, but it's not quite so straightforward as in a hospital where you've got big teams. So have you had any conversations with universities about, because I had one or two conversations about how we try and bridge that gap between newly qualified, degree qualified nurse and someone ready to go in primary care?
Love it when I have an answer ready. I do. So we have been working with St George's. We've got two programmes with them. One's called Foundation Training for Nurses. We've been working with George's on the intake of them. So I think the challenge before has been they only intake them once a year, which isn't much use to you when you employ them in November, but their programme doesn't start till September. The Foundation programme is a 6-month programme. The Training Hub is funded by NHS England to also then provide the practice with funding for supervision, as well as this Foundation and academic programme. I can pick that up with you. And I do think that one of the bits we've picked up from the qualitative data from our 55+ nurses is using our existing nurses that are able to be what I would describe as legacy nurses and using their skills better as they start coming out of some of that clinical work. Can we be using them better? Can I give them to your practice for half a day where you've got a new to primary care nurse and they can be working with them? And I know that loop of you've got to get them assessed, and if you don't have the assessor on site, how do you actually train up those new to primary care nurses? So how do we use the ones that are now coming out of the workforce to support the ones coming into the workforce, hoping legacy nursing will start, not fix all the gaps, but start baby steps into the right direction.
So Larissa, this is now for you to conclude. So how are we going to try and make some of this sustainable? I know there's some activities in the year ahead as well that you might want to cover off.
I think what you've heard today is that partnership working works. The benefit of working together and the value it's going to have and has had on our communities is significant. And we want to continue doing that beyond the life of this particular project. I think the point I really want to make here is in the way that makes sense to our local communities. I think historically we haven't always done that very well. We've kind of tripped over each other and it's been a bit clumsy. So I think there's learning that we can gain from this, that we can do it in a more streamlined way and more collegiate way going forwards. There have been a number of challenges. So we've heard today people ask questions about, well, how many jobs have people got as a result of that? One of the things that has been a frustration for me and others alongside me is the limited access to jobs in health. Not so much true for social care colleagues in the social care sector, but in the NHS, we haven't made enough jobs available. That sounds like a strange thing to say, doesn't it? We're thinking about the number of organisations we have and the size of the organisation. Some of that's about how we make that available. We're quite rigid and prescriptive about the type of person that we're looking for and the type of qualification they need to have to be able to access jobs. We need to change that. In terms of work experience placements, we haven't seen as many coming forward, certainly from secondary care. I was quite surprised, actually. I thought we'd see much more in the secondary care space in terms of work experience placements being made available. Not the case. We saw that more in primary care, an area that we think is quite challenged. They're small businesses, but actually they did open their doors. So there's more work to do there. We know that capacity amongst our middle managers to support this is an issue. And also the sticky middle, or the treacle layer, sometimes they're called, aren't they? They've got a difficult job to do. Sometimes they are the gatekeepers to some of the work that needs to be done, and we've addressed that through working with higher education again to develop a programme of training to support middle managers to think in a more inclusive way, and we're looking to roll that out across the, well, we have rolled it out across the system. We're looking to expand that, so we've got another placement due to start in April, 60 places available for managers across South West London to join that. That's at Roehampton University, and it's an accredited programme. We've also seen limited availability of apprenticeship. Again, another area of frustration. There's a lot of interest in the community in taking up apprenticeships, but we've not really seen space made for that within our organisations. A number of constraints that impact that. Operationally, we've got really challenged organisations, and then the backfill issue is something we need to look at. And then we've also seen and heard of childcare impacting people's ability to access or enter the workplace, not because they don't want to. So we need to think about being more flexible as employers there as well. So we've spoken about evaluation of the reports. There's some great stuff going on. I'm really excited to hear about that sort of close down and where some of those projects get to, but we don't want to lose traction. I think we need to share the learning and look at how we can continue that. Not yet cracked that, because as we know, there's no additional funding beyond March 25. We have got existing programmes of work, and it's thinking about how we align some of this to those going forwards. More to come on that. We have a workforce delivery plan for next year. I'm not going to go into it now because I think it needs further refinement based on the evaluation documents we're yet to receive. We want to make sure that we're really focused. There isn't a lot of money, so we need to work in a streamlined and effective and efficient way. So I'll come back and talk about that more later.
Larissa, colleagues, thank you very, very much for that presentation. Really exciting, great work. And it's good to hear the creative thinking around how we make this sustainable in the absence of a dedicated pot of money. That isn't to say there isn't money in the system. We have significant amounts of apprenticeship funding, which each of our trusts are currently not utilising. So there are opportunities. A couple of points, so I'll take Mel and I'll take Zara.
Thank you. Just a quick one. So we're always talking about the money, but just thinking about the carers, any training, once gained, that qualification is something that cannot be taken away from that individual. So life chances, it's a great thing. But thinking about community upskilling, if they don't go on and get a job in the NHS from that, when you think about how much care takes place in the community and the amount of the things that they gain, the unpaid carers, for example, we're moving towards more care happening outside of hospitals. So those skills, wound care, medical terminology, falls prevention, those sorts of things, they're not lost. There are social value, social benefits from that as well. Thank you.
Zara?
Thank you. Actually, following up on that, so comment from my leadership group, if I may. They said the latest NHS staff survey revealed that 1 in 3 employees also have caring responsibilities, and encouraging NHS providers to work towards the care confident employer status could help with staff retention, reduce absence, and improve staff well-being. And the VCSE sector can help providers in becoming a carer-friendly employer and kind of do those referrals that are really, you know, into community settings, and kind of following up on that as well, and looking at the papers you presented, I would say the voluntary sector can really help you in reaching those communities, those diverse communities you want in your workforce. And I noticed that in the first part of the plan for 25-26, under supporting local people into local jobs, there is quite a lot of reference to the VCA sector and working with us. So it's not a conversation I've had, so I would love to have the details of that, because I think it's something we can collaborate on a bit more.
Zara, thank you for that kind offer. Larissa, I'm sure you'll take note of that and come back to Zara so that we can make sure that we utilise that. We'll move on to health inequalities. John, I believe you're going to be...
Myself and Catherine.
Sorry, Catherine?
Good afternoon, Chair. Apologies to everyone, but the next 20 minutes will be a combination of Irish accents. Obviously, Dublin, the Queen's English, and Cork, and the less said, the better on that one, so I'll move on. So, look, delighted to come back and talk about health and healthcare inequalities to the group. I'm mindful we've got about 20 minutes. We've produced a lot of data here, so I'll get Catherine to run through the slide deck, but there might be more benefit just to open it up for quizzes and questions as part of the discussion. This is part of our regular feedback to the group on the work of the ICP Health Inequalities Working Group, which isn't just about health and very much involves our local government partners and also the VCSE in the various strands that we've got up and running. Just to flag in advance, a lot of our healthcare programmes in terms of the Health Inequalities Fund are currently undergoing evaluation, so we'll be back in the near future to answer some more of the specific questions as did they actually work, what was the value for them, and did they actually move the dial. So I just want to avoid any disappointment in advance that until we get the evaluation in, we'd be slightly guarded on what our responses to those questions might be. Catherine.
Right. Hello. Those of you who don't know me, I'm Catherine Heffernan. I'm Director of Health Improvement at the Integrated Care Board, but I believe you do know me because I've been here before. So I'm not going to go through slide by slide. I'm going to presume that you've all read it as your bedtime reading. And that way then, you know, we can have some more questions and answers. So just quickly to recap that we are using the terminology of health equity, which is the larger umbrella term. And under that, you've got health inequalities, healthcare inequalities, and inclusion health. And it's quite important to know those distinctions. The health inequalities is a priority of the ICP strategy, as you know. And really this presentation is just to show with you the work that's been happening over the past year. So we have the Health Equity Partnership Group, which reports into this group, and that meets quarterly. And under that, we have our little doing groups who are beavering away and working very hard at delivering stuff. And one of those working groups is the Health Inequalities Delivery Group. And whilst we meet to deliver the delivery plan, which is in the appendix of this slide deck, we do actually quarterly meet to monitor the progress of the projects that were funded by the Health Inequalities Investment Fund. So we have been keeping an eye on how the projects have been going. So to quickly recap the projects, so we had 39 projects that were funded by the Health Inequalities Investment Fund. The vast majority of those were at borough level. And indeed, not only are they monitored through our Health Inequalities Delivery Group, but actually place level or borough level have also been keeping an eye on the projects. South West London-wide, we had 3 projects that we invested in. One was the Core Connectors, which was actually a national programme, but we put more money to that. And the connectors essentially connect people with healthcare services around the core 20 plus 5, which is the NHS England approach. We also had Spear, who delivered for us health and wellbeing days across South West London and reached a huge number of homeless people, which has been one of a really, really heart-warming, fantastic outcome. And we also had the community health and wellbeing workers, which many of you will know because this was based on the Brazil model. We started running it in Battersea, then opened it up to run across South West London. Westminster has been running it a bit ahead of us. So whilst our rapid evaluation isn't due in until next month, again by University of Roehampton, who seem to be doing quite well for evaluations around here, we are working very closely with Westminster, who are ahead of the curve, who have not only done control studies to show the benefit that this brings, bringing in people who weren't accessing health services, particularly people who actually have high needs. So there was a huge number of undiagnosed diabetes patients, etc., and also significantly increased uptake of screening and IMS. So we do work with Westminster, and we are hoping to work with them on their randomised controlled trials in the future, which those of you will know that's like the gold standard for intervention effectiveness. So a lot has been happening. Going forward, we're very much focused on that actually to help tackle health inequalities, we need to tackle the wider determinants. So work will continue on that. So there's certainly a lot of work going on in our green plan area as well, in our environmental area, because those who are most vulnerable actually to climate change, for instance, are actually those who are living in the most deprived areas. A lot of work going on there. We also have a lot of work going on at borough level, which will continue tackling health inequalities and healthcare inequalities. And within the ICB, we do have plans to work more closely with our Q trusts on their health inequality strategies and trying to reduce healthcare inequalities. So whilst the fund of the projects are coming to an end of March, the work on trying to reduce health and healthcare inequalities does not stop. We will continue addressing that through our prevention work, through our community empowerment work, through addressing the wider determinants of health, and through helping people with health literacy and self-care. So that doesn't finish, and we also will continue helping to deliver the regional aims, for example, the Million Hearts, a Million Minds around CVD. So I just wanted to give you that assurance that we've not forgotten about health inequalities going forward. Oh, and I forgot our big thing that we did that I should showcase is that we actually cracked a really difficult nut, because one of the things we're very good at in the health inequality space is forever cutting data in so many different ways. But actually this year, a lot of work has gone in to develop a data platform where we can track changes over time. So not only can we see where we're making a difference, but we can also track where there might be an emerging problem. And that is something that has been an absolutely fantastic step forward. Thank you.
John, did you want any final words?
Yeah, I'll just add, in terms of the data platform, if you look at the data platform, you can see we talk about health inequalities in terms of financial background, ethnicity, and age. Now, the ethnicity one encompasses a broad range of people, and we can dig down deeper into that. But if you just look at a couple of the indicators there, you will see that in terms of myocardial infarction and stroke presentations, people from an ethnic minority background and people from an economically deprived background have higher presentations and poorer outcome. Now, just because you are from an ethnic minority background, to clarify, does not necessarily mean you're going to be poor, but there are some genetic influences in there. So when we look at that data, and we also know that there are 30,000 people walking around South West London with undiagnosed hypertension, and we also know that the people who we've got who have hypertension aren't being optimally treated in the way that we'd want them to, that lends the argument, well, what are we going to do about it? So in terms of cardiovascular disease prevention, we are kind of hoping that London will run with something called a Million Hearts and Minds programme, which is focused on basically picking up the hypertension which hasn't been diagnosed, not just through traditional general practice routes, which are very good at doing it, but opening up access in other community spaces, whether it's community health workers, community pharmacy. Because if we can identify those 30,000 people and treat them to target, we have a fighting chance in terms of reducing some of the UEC pressures many of our acute colleagues will be figuring this type of year. So there's some simple data, there's the argument, and then what we need to do is look at our prevention funding, which sits within that healthcare space, and think how we were going to roll out a programme and do it once and do it properly across South West London, which might mean some of those health-related pilots which we've been doing over a period of time, which have merit but don't necessarily move the dial. So in some ways the challenge we are facing financially is actually our opportunity, because it's allowing us to think about really what do we need to focus on and where will the win be and where are we more likely to benefit a wider proportion of people who are more likely to be deprived in terms of health and health equity, which will be people who are tended to be poorer and some more from a minority ethnic background, which is why you will hear us sort of say, not going to bet the farm on million hearts and minds, because we need that to be adopted across London. But I think going forward, our one bet is going to be cardiovascular disease prevention. And for that, we are going to rely on the engagement piece. We're going to rely on the voluntary sector, particularly the voluntary element of the voluntary sector, because it's the only way we can reach out to our communities who are currently not accessing healthcare through the traditional routes.
Thank you, Catherine. Thank you, John. I'll open up for questions, but I'll sort of make a comment. I think it's important to say that these are projects and programmes and approaches that actually work because we are a partnership bringing together the voluntary sector and our colleagues in local authorities who not only have the largest part of the prevention budget, but actually have levers to affect many of the wider determinants of health. That said, outside of this room, through the Integrated Care Board, we are also looking at the healthcare equity piece, particularly what might be called allocative equity, because at present, we actually, we have not unwrapped the inverse care law. We spend much, much more in areas of affluence than we do in areas of deprivation. So the areas which, and Peter, we were talking earlier about a very precise example within your borough in terms of investment in one part of the borough and not in another, which actually is the sort of stuff that we as an ICB need to be tackling moving forward. So that's assurance from me that the ICB is looking at that and taking that work very, very seriously, and that will make a significant difference to many of the adverse outcomes that we currently have in our poorest communities. I'm going to open it up for comments now. Sarah.
Thank you. I just wanted to be put on record what a great idea I thought it was to ring-fence part of the budget for preventative services. And I think if we want to do shift-free, that's the only way we can achieve it, is prevention and long-term. And yes, may I say, obviously, the voluntary sector was disappointed that we're kind of moving away from this. And I think there were some fantastic projects, and we'll see in the evaluation how much they achieved as well.
We haven't forgotten about those projects, and I know we've had a conversation that we will work with the voluntary sector because there are other funding pots out there, and maybe we could help continue them in some shape or form, because there has been some good work. Absolutely, yeah.
Andreas.
Thank you, Mike. Having a question from Piers, who can't be here today. On behalf of Piers, I'm asking his question. If South West London and ICB are shifting available investment from health inequalities into primary care, may the ICP have a paper on the priorities the ICB have identified for investment and how this may have been informed by the public deliberation on the future of the NHS care in London, for which the report was launched at the event last year? There has not been a discussion of that report within the ICS as a whole. It would be really valuable to share which findings across London resonate in our sub-region and which we can get together behind.
So I'm actually going to bring Katie in at this point. I think you're referring to, I think Piers was referring to the Primary Care Deliberative Inquiry, which I happen to chair on behalf of London. And we would be very happy to share that, but I think it's important we put it in the context of the wider work that we're doing, both within London on the London Transformation Plan and in relation to the 10-year plan. And we've also got work that Lucy Waters is undertaking for us in terms of how we prioritise investment in primary care. Katie, this is your bag, this is your area.
No pressure on day 13. Thank you, Mike. I think it's really, clear that actually we know that where we are is we have an unsustainable system, and actually the highest volumes of spend are not delivering the greatest return in terms of health improvement and addressing inequalities. So as part of my recruitment process, part of that is to do a real proper plan to get us to a sustainable South West London, which is absolutely grounded in delivering the best return in terms of health outcomes and thriving communities for people in South West London. So I know some people raise their eyebrows and think, oh, another plan, but actually my reflections coming into South West London is that we have many, many plans, and the trouble is in that situation is when everything becomes a priority, nothing becomes a priority. And to John's point, really, if we really need to make sure that we're maximising the value for every single pound of taxpayer spend, we need to target it where we will deliver the greatest impact. So one of the things I will be starting to do is involving you all in a clinically led, data-driven, renewed, refreshed, updated piece of work, using all the really great work around joint strategic needs assessments, all of the work that's already in place, to really assess where we can have the greatest impact, either in terms of overall health improvement or whether that's around narrowing inequalities. So that's going to take us a few months to do it properly, make sure it's data driven, it has to be clinically led, patients absolutely at the centre, communities and citizens at the centre. So it's not 5 minutes work. What's helpful is we have the framework with the emerging work that's coming out of the 10-year plan. So we're clearly not going to do something in splendid isolation from that. And there is a huge amount of organisational knowledge and memory that we have across the patch. So I think it would be premature at this point to say we're removing investment from this or we're placing investment there. What we need to do, because we can't salami slice anymore, we can't short-termist approach to things. The profound nature of the challenge for us, both in terms of outcomes, the inequalities piece and the financial sustainability, means that we need to come together once and for all to have a plan that we can all commit to, that is deliverable, and then really importantly focuses on execution, the priorities within it, and gives our teams permission to deprioritise the things that are not priorities that we collectively sign up to. So I'm not sure if that's what you wanted, Mike, but that's what Mike has tasked me with doing. So
that is hugely, hugely helpful, Katie, and a commitment from both Katie and myself that we will engage you as partners in the development of that plan moving forward. So not just this partnership body, but the organisations and the systems and the places that you all represent around this table. So that's a commitment from both of us on behalf of the Integrated Care Board. Nick, did I see your hand go up, or am I wrong?
It did. Just to follow on from Zara's comment about how the voluntary sector can work with primary care on these things. As you mentioned, John, 30,000 for hypertension. I don't know what the numbers are for diabetes, but cardiovascular disease, cardio-renal-metabolic disease, as we're starting to call it. That we know that there's large numbers of people out there with unmet need, and we can't do that on our own in primary care because we know people are just not coming. They're not darkening our doors at the time we need them to. So it's working with our voluntary care colleagues, faith groups. We need to be working where people are. We need to be doing that in integrated neighbourhood ways, and we're up for that in primary care. And in fact, our brand new general practice contract, which came out a few days ago, has got a particular focus on cardiovascular disease. I've not read every word of it yet, but it's I think all of these stars are aligning for us to focus on this area within primary care. I'm sure Dino might disagree with me. Thanks.
Dino, did you want to say anything on that?
Thank you, and thank you for the presentation. I think it's extremely helpful and informative. On the cardiovascular piece, I think as from a Sutton perspective, we've actually done a piece of scoping already, looking at our joint strategic needs assessment and looking at our priorities and looking at the data, and we've come to that very conclusion as well at a place level that cardiovascular disease is our priority. So actually all 4 of our INTs, our integrated neighbourhood teams, have taken that on and as a priority alongside other priority areas that they're working on. And we've done quite a lot of work as in the pack in terms of the inequalities work in Sutton. So absolutely agree that cardiovascular has that ability to cumulatively make a big shift. And it also gives us the ability to understand how we can work together, in other areas as well going forward. So how we actually work together at that local level to make those changes, to then look at perhaps doing more work upstream or more work across other long-term conditions, which we all have a need to prioritise. Thanks.
Thank you, Dina. John. Sorry, I'll take Hannah and then I'll go to John for final words.
Thank you. First of all, can I just say, John and Catherine, thank you for the presentation pack. And I think what really was quite profound in your pack was actually the work that happens within place and how it came down into community level. And I just really welcome that commitment, Katie and Mike, because I think there's a couple of challenges, and it almost links back into kind of that earlier presentation around the workforce. We really are challenged by short-term investment, because we get these chances to apply for funds, but they're very short-lived. You've got some amazing work that's happening down within communities, and all of a sudden it's trying to grapple with how do we take the learning, what else do we do, and how do we plug those gaps. And I think that planning, about thinking about that evidence base of what's already happening in this space across the health and care system, public health, and is there a better way of coming together? And one of the examples in here, and I probably picked it because it's Merton Borough, so my apologies for that, is the social prescribing model with CYP, and we've seen the success rate halfway in adults on this, and that opportunity to do that forward planning, that we don't just start with, you've got this fund, it finishes in March 25. We start with the project and we think, where do we need to take it? And I know the evaluation comes late, and that can be quite a challenge, can't it? Because by the time the evaluation happens, most of these fundings finish in March. Councils have already set their budgets. So there is something, I think, about being a little bit of ahead of the game on this when these projects start up. And I think this planning where we come together is really, really welcome, but some fantastic work.
Just to come in on that, you're absolutely right. And one of the things we're trying to change too, which hopefully one day we can come to you and speak to you about this, is to change the mindset that when you apply for funding for a project, you evaluate as you go, and that you know where you're going, rather than, because we're very good at saying, I have a great idea, let's try it and do it, and then try and evaluate after. And of course, what happens is we're in the situation we're in now, project ending, doing the evaluation. So that is something. So hopefully we can come speak to you about all the work we're doing to help embed an evaluation culture across South West London.
So just one other thing to add on that. We know in terms of healthcare inequalities, the biggest challenge is initial access. So actually, from the data that we see, once people get into services, into general practice, they get referred on fairly, although there might be some delays, which are for complex reasons. They get into secondary care, we're not seeing any significant systemic sort of practice which is holding certain communities back, but it's something we need to be attentive to. So it's about access where the community healthcare workers come in, but you'll see in the pack there's over 35 variants of what that's going. So I think we're reaching the conclusion in South West London there needs to be a one approach to this in terms of making every contact count, but focusing on the access piece. In terms of settling on cardiovascular disease prevention, that obviously includes smoking cessation, which obviously sits with our colleagues in local government, with elements sitting within secondary care. So that is a war we still need to continue to fight. Likewise, obesity. So anyone who's been paying attention know that there's a glaring health inequality under our noses, that if you have £2,000 in disposable income and happen to be overweight, you can access weight loss drugs. If you don't, you can't. There's a new drug coming on the market. We're rolling it out, but it's only to about 10,000 people in a very defined cohort in July in South West London. So we have some of those challenges that we have to bridge. But I'm optimistic because, in fairness to general practice, they do a brilliant job. If you look at a lot of the metrics in general practice, they're pretty good. They're seen pretty favourably. Now, we do have some innate advantages in South West London compared to other parts of the country, but nevertheless, we get a lot out of general practice and community pharmacy in South West London. So I think that's an area for celebration. But in terms of tackling this cardiovascular disease challenge, I think we need to go a little bit further and a little bit deeper into our communities with a slightly different approach, which includes community healthcare workers, but includes digital and perhaps just helping us shift the dial. Because if we do that, I'm convinced that the UEC pressures that we're currently seeing, the corridor care, which has just become ubiquitous around the country, that is the only way we can turn off that tap of people who are finding themselves with conditions which are certainly in the earlier stages far more preventable, but as you get older things become more common. But there are too many people suffering premature health problems at a younger age which are absolutely avoidable with some simple interventions, which also includes medications.
John and Catherine, thank you very, very much for that. And colleagues, thank you for your contributions, particularly in relation to your endorsement of cardiovascular disease. That's incredibly helpful for Katie and myself in the discussions we're having within the London Transformation Board about the potential London priority attached to that. And that will be really helpful for us to be able to say South West London largely endorses that approach and that priority. I'm now going to hand over the chair. Apologies, I'm about 5 minutes behind, no, 3 minutes behind. There you go.
Thank you, Mike. So next is our last substantive item on the agenda. It's the Get Britain Working Trailblazers. And we have Polly and Matthew Hamilton here. Polly is the Head of Economy, Skills and Employment at the South London Partnership, and Matthew is the Director of the South London Partnership. So they will introduce the item.
I'm going to very much let Polly introduce this because I'm very conscious that I took up a lot of the board's time last time. There's only so much the board will want to hear my voice, and Polly's very much leading on this, so I'm handing over to Polly.
Thank you.
Thanks, Councillor Kirsch, and thanks, Matthew. Yes, so as I'm Polly, and I'm Head of Economy, Skills and Employment at South London Partnership, and as such responsible for multi-million pounds worth of employment support programmes that we deliver across our 5, sometimes 6 boroughs. And for the case of Trailblazers, which we're coming on to, we will be including Wandsworth in our delivery, which is great news because it makes it so much easier for everyone sitting around the room. So in the Get Britain Working White Paper, which was launched in October of last year, the government set out their intent to support and improve economic inactivity across England. We have rising economic inactivity. I think it sits at about 22% now and rising. We have some of the fastest levels of rising economic inactivity in Europe, and over 7% of that economic inactivity is due to ill health. So people not in employment or not looking for work due to ill health. And the government want to tackle that through a range of different interventions. They are investing over £200 million across the UK to develop different programmes to support people back into the labour market. Obviously, to boost productivity, we're struggling with productivity levels nationally, but that's good news for South London as we strive to create a really strong, skilled workforce. So what does that mean for us in South West London? I think at the last board, Matthew talked to you about Connect to Work, which is a new national employment programme that's being launched, and that is supporting economically inactive people, but a very specific programme of person-centred, individualised placement support and moving people very quickly into employment. And that programme isn't suitable for every person, and certainly not for people who may have significant multiple and complex barriers which are preventing them from moving into jobs. So within the Great Britain Working White Paper, they announced 15 trailblazers, of which some of those trailblazers will be delivered in London. £20 million worth of investment has been made available to London to create innovative programmes of delivery and new integrated partnerships to deliver employment support for economically inactive people. The GLA are holding the ring on this funding, so then currently negotiating with the DWP on the terms and the delivery plans of that funding. But in the background, myself and Matthew and the team are working really hard to secure a share for South West London. I think at the get-go, it's really important for me to say that timelines have been very, very tight. We were given the information at the back end of December and asked to submit a high-level delivery plan in 4 days, which we did, but obviously didn't give us a huge amount of time to do a lot of engagement with wider stakeholders. However, we did manage to do that, and we've continued to do that through the process of development. We've also been working very much with our member authorities who have employment specialist services, and we've taken a bit of a ground-up approach to make sure that we are engaging with as many stakeholders as we can to develop the programme. So in terms of where we are within negotiations, the DWP have had the high-level proposals but are coming back and asking for a lot more detail. The challenge we do have is that funding starts on the 1st of April and finishes on the 31st of March 2026. So we've got 12 months to deliver innovative programmes and complete evaluation. So I think we can all appreciate that timelines are tight, but we're working really, really hard with our teams to develop really meaningful, new, innovative approaches to these trailblazers. So what are the trailblazers? They are investing in developing the infrastructure and structural changes that we require to ensure that health and care and skills and employment provision is better integrated, strengthening the partnership on the ground, very hyper-local in localities, to identify new routes to participants who could really benefit from employment support. So working within our primary care networks, our integrated neighbourhood teams, but also across our employment and skills providers, across our voluntary community sectors within our communities to identify new routes to participants. So making sure that we are reaching people who do not ordinarily engage with employment and skills services. But it's also essentially delivering job outcomes. So one of our outcomes is moving people into work, but with a more job-first approach. So having a longer time to develop individuals and move them into employment. So, I mean, they're the two major outcomes of these programmes, improving those integrated partnerships across health and care and across other organisations, and moving people into work. So, as I said, at the moment we're working really hard to secure that investment. We're pretty confident that we will get investment, and we will probably know that in the next 3 or 4 weeks. So it doesn't give us a lot of time for mobilisation implementation. So we are looking at where we've got potential projects that are ready to go. We've also done a lot of work with some people in this room and with other care providers to identify specific projects that we know may not be picked up through Connect to Work. So we anticipate that Connect to Work will really focus quite heavily on mental health. The individualised placement support has been built around supporting people who need support around mental health, and so we anticipate that MSK particularly might be a lost group, but we do know there's a huge opportunity to impact that. We've been working with the Health Inequalities team on how we can use their app and Get You Better app to scale up some of the work that they've done, provide personal support around that. We are also looking at a triage service. We do know that the skills and employment system is really difficult to navigate, not just for practitioners who are trying to support people, so your social prescribers, your community link workers, your health and wellbeing coaches, but it's really difficult for individual participants to navigate. So creating that one space triage service, working with the systems to create really easy referral routes, particularly for the GP surgeries. It's something that's been trialled in West London that's worked really effectively. So we'll be looking to and pick up that and pinch that with pride where we can, not reinventing wheels, but really using what's worked with some of their Work Well projects. and obviously supporting our providers locally to deliver that job brokerage service, and supporting our employers to think about creating inclusive recruitment strategies and providing inclusive recruitment across South West London. That's a flavour of some of the projects. Obviously, we're going through refinement. This has been really rapid development. We've got some shovel-ready projects, as we call them, so some that were waiting to go but just required a bit of investment. We've got some that we're working hard to develop quickly with local areas. But our key is how we engage new people, how we really work out within the communities. But at the moment, we're really focused on securing that investment for South London. And as I say, we're pretty confident that we will secure a proportion of that 20 million, but at the moment, working really hard just to get that in place. I think from our perspective and moving forward, we're really keen to ensure that from an operational delivery, but also a strategic steer, that we have the governance in place, and we're working to do that. And we would obviously like to work with members around this table to ensure that what we deliver is effective, but also that the health and care that might sit around some of our employment support, that we can access or support our participants to access. And really, how do we maximise this service, and how do we maximise the impact? You know, questions to the table really about what are the things that we can do to maximise the participation and make sure we have and we're accessing the right people, and that we're providing a service that's beneficial to you, and almost make sure that we have that feedback loop, and that we're coming back to you and we're telling you, you know, how effective our programs have been. We are trying to innovate and pilot, so we know with innovation sometimes we take calculated risks and we anticipate that not everything is going to work, but we're really hopeful that the things that we're coalescing around will have a really substantial impact, and evaluation is going to be a huge part of this, because we want to be making a business case for the future. We are hopeful that the next funding round, there'll be opportunity to extend the funding beyond the 31st of March 2026. So we are preparing our business case and using this as seed funding to really accelerate some of the good work that we know that we can deliver through Trailblazers. And yeah, so it's open to the floor really. How can we make the most of this? How can it be most impactful? And how would you like to work with us?
Thank you, Polly. Thanks for the presentation. I mean, it's really exciting, another project, the Trailblazers, to get, you know, a group of people who are economically inactive back into work. And it's not just, I think, about work. If our context is also, if we get them back into work, it's definitely helping their mental and physical well-being. So exciting project. So the board is asked, you know, any questions, or you're asked to reflect on the outcomes and any key priorities you would like to see moving forward. And Polly already said if you know further engagement is more than welcome, and be in touch. So handing over to the board. John, please.
So I'm going to bring a rather medical focus or health focus to this. So we know that many of those people who are economically inactive, as the paper points out, have long-term conditions. And many of those long-term conditions will be obesity related. We've seen Manchester steal a march because they're having a big investment programme which has been overseen by DHSC with regard to the use of weight loss drugs and supporting people to become more economically active. Excuse the pun, I don't have any shovel-ready schemes, but I have an oven-ready scheme which is ready to go, which would allow us to support an element of that cohort with disease-modifying drugs to support them with their obesity journey, which will probably have a beneficial effect on their ability to get back into work. And we can do that actually from early April, because the cohort for that group is with a BMI of over 35. We in the NHS are limited to a cohort of 40 and over, 37.5 for ethnic minority groups from July. It's only 10,000 people in South West London, some of whom will absolutely be in the cohort that you're thinking about in terms of economically inactive. So there is a crossover there for this group, I think, but I think there's an opportunity, if there is funding available, to perhaps be a little bit bolder and perhaps target a younger community who have more economic years ahead of them, as opposed to just necessarily a more mature group of people. So there's an offer. Happy to chat with you outside the room, but I think there is an opportunity here for us in South West London to embrace new medical technologies to help our fellow residents live a healthier life and get back into an economically active environment.
Thank you. So it's absolutely something we need to definitely have a discussion about. I think the investment for the funding has criteria that might mean that we couldn't fund specific treatments or services. However, there's definitely an alignment between that and the mindset, employment support, and the route and access to people who require that. And certainly it's definitely worth a discussion, and bringing in some of our employment specialists to talk to you about what that might look like in practice.
Thank you. And Alyssa, please.
Thank you for that presentation. Just a quick question. I was wondering how you'll incorporate service users' experiences into both the rollout and the evaluation. I know the design is, you've only had 4 days, but if there are any learnings from existing similar programs across South West London, if those service user experiences could be incorporated.
Yeah, so within the development, we have managed to capture a small amount of service user reflections, and we have engaged a small amount of potential service users, and it's allowed us to shape some of the activity that we've done. But given the time that we have had to develop, it's been really difficult to do that robustly. However, it has been done quite robustly for Connect to Work, and although they are different delivery models and programs, they are supporting a similar client group, and so we have been able to use some of that evidence. I think moving forward and as part of the evaluation, absolutely participant experience is going to be key. And so we do, as all of our employment support services, we have a start measure and an off-board measure, and that's beyond job outcomes or skills outcomes. That's about experience and making sure that our delivery providers and our employment specialists are evaluating not just the service but the experience of the users and the employers, because that's equally as important. We have to create employment opportunities, and sometimes our employers have to adapt and respond to the needs of the individuals, so having that employer evaluation will be vital, and that's built into our service models. Thank you.
Thank you. I have Karen and then Sarah.
Hi, Polly. So first of all, well done for getting the bid in 4 days. They're horrible, aren't they? There's trailblazer bids. So well done. And I recognise that because of that, you haven't had a huge amount of time to do all the things that ideally you would have done if you've had months. But I was going to just ask, in terms of the areas of interest, there are obviously emerging areas of interest based on those very initial conversations. But what's the route to get to the final list of the priorities, and what's the governance around that, I suppose, is one question. My second is a kind of a reflection, which is, and I think I said this when we were talking about Connect last time, the world of getting people out of unemployment and into employment is a really busy field if we're not very careful. So for me, there is something about how do we connect the conversation we had last time, this one, all the work that we saw at the beginning of the programs, the thing that we have not, and Larissa mentioned this in terms of the workforce learning, the things that we haven't been able to do is the thing that we need to do in this, which is the outcome has to be employment. And unless we've got a really slick and well-established route into employment, we will train lots of people, but we'll fail at the last hurdle. And that means that we have to engage in employers, and they have to have vacancies, and we have to do all of those things. So there is a danger, I think, that we've got the front end right, and we haven't got enough time to sort out the back end, which is actually the outcome part. So I wondered how we can work better together to make sure that we aren't putting massive amounts of stress and requirements on employers and how we simplify those parts of the pathway so that we do what we intend to do, which is to absolutely get local people into employment swiftly and well.
Yeah, so if I take your final question first, I think, so, and I don't want to conflate Connect to Work and Trailblazers because they are two different programmes, but primarily they are moving people into employment. And actually, employers are at the centre of Connect to Work because each individual has an employment specialist who creates the pathway around the vocation that an individual wants to be in. And actually, as much support is provided to that employer to create the right experience for the incoming employee as it is to the employee, because actually longer-term sustainability is very important in those situations, and they're provided up to 12 months of support, both the employer and the participant. And there's lots of international research on that kind of individual placement support model, and we have a big fidelity scale that requires 25 steps of good employment, and it includes supporting the employer, but it also means that anyone delivering that has to have really robust employer engagement strategies, and that will be, you know, beyond health and care, but can include health and care, and we would want health and care to be a beneficiary of that. And actually, how do we make sure that the providers that are delivering Connect to Work are really plugged in to all the recruitment opportunities, but we create maybe individualised pathways for those training programmes might be a way forward, and we can test and pilot some of the ways that we do that. I think Trailblazers will be slightly different, and it will be a job-first approach. So we will be finding the vacancies and then supporting people with training to move into those specific vacancies. So much like the banded sector-based work academies, but our employment specialists have been delivering that sort of employment support for a long, long time. So a long way of saying employers, getting that employment pathway and journey is going to be key. We have our providers, so our member authorities have extensive experience of delivering that kind of support to employers. And through our No Wrong Door Integration Hub, we've been delivering training for employers on inclusive recruitment. And that's where we've been bringing people with lived experience in to employers to talk about their employment journeys and how they've found working and also finding work. But we have a lot more work to do in that space. And in the Get Britain Working White Paper, the government are also working and talking to businesses. We also have a local skills improvement plan and we're working with our businesses to try and support them, because we're very conscious of the responsibility that we're putting on our businesses, and in South West London as across the country. A lot of those are small, micro, medium organisations that don't always have the capacity. I do think that as within the public sector, within local authorities and within our health providers, that we do have a responsibility to lead the way in some of this. And so we'll be looking to our member authorities, and we'll be looking to NHS partners to discuss, and our university partners, about how we can lead the way on creating more inclusive recruitment opportunities. To answer your first question, we are currently in the throes of digging deeper into the delivery plans. So we are now, of yesterday, reaching out to partners to say, you know, this is the skeleton of the delivery plan. How do we build on that to move quickly in April? At the moment, it's going through South London Partnership governance. So we'll take it to our growth directors tomorrow. It's been through our chief execs, and we'll go to our leaders from our internal organisational governance. But I think we've got a little bit of work to do on the operational governance and making sure that we are bringing the right people in, and we're talking, you know, across multiple channels to get that focus right. I think I just have to manage expectations. We're not going to have 20 million. We will have a share of that. and this is going across London. And we have a very short space of time to mobilise and deliver, and we'll have to deliver output. So we're taking quite a pragmatic approach to how we're developing this piece of work within the constraints of not really knowing at the moment, and probably not knowing for another 3 or 4 weeks whether how much money we've got. And so it's been a bit chicken and egg. When do we go? We want to engage everyone, but we don't really know how much we've got. It's been quite a difficult process, and we are feeding back that the timelines have been really difficult, and London councils are working on our behalf. So it's been really challenging, but it's very exciting. There's huge opportunities to do some really innovative work.
Thank you. The last contribution from Sarah, and then we have Matthew, and then last words to Polly. Sarah, please.
Hi, a request really, and I appreciate the time frame is a bit crazy to say the least, and obviously you're just redefining the structure, but I would like to just encourage you to utilize voluntary sector organizations as delivery partners, whether it is through a small grants program or whether it is through subcontracting, because we've got some amazing organizations across South West London.
Yeah, thank you. And we'll certainly, so I think from an SLP perspective, we won't be delivering directly, but we will certainly make sure that that happens, across our member authority deliveries. And I do know, for example, there's been some great work done in Kingston, there's been some great work done in Croydon, there's been some great work done across Richmond using VCSE, so and using partners to do that outreach, particularly the outreach and delivery, but we would look to continue that. And there is a stream around carers, and we've been working with the Sutton carers to look at what that looks like, and we've been I've spoken to Nick about what that might look like in Richmond and Kingston. So it's absolutely the space that we want to play in, and with Connect to Work as well, so making sure that we use all partners. Thank you.
Thank you. Matthew, please.
Yeah, just a couple of points. Funding, that's always a fun game. I think the initial view was it could be based on numbers of economically inactive, and I push back quite strongly on that because obviously certain parts of London have already had access to work well, and therefore the infrastructure is there in a more integrated way. And I think I've been, touch wood, relatively successful in that. So I'm keen that we have a model that reflects where we are in this journey. And I think we'll have that shortly, but it will be in a better position than I think it would have been initially. So that's good news, but I don't want to commit to that until I see the final number. I think the second point I want to say is that it's been really good to talk about this and talk about work well here, and I think that demonstrates the importance that all of us are placing on partnership. I know that other parts of London have not had that opportunity to discuss that, and I think it's really important that we use this forum to test and challenge some of the things that come up, because there will be issues that we can unlock. And I think anything that NHS colleagues can do in particular to push the sort of, you rightly say, Karen, how can we measure how many people are going into work? Well, not very well if it's only for 1 year's funding, bluntly. At least Connect to Work is a 4-year programme. So the more that we can be saying, actually, this needs to be a much longer term approach, because then we can better measure what is working well and where people are actually getting into employment better. And I think the more that all of us can be saying that in whatever forum this pops up in would be really helpful. But it's been really good to be able to have the opportunity to discuss that in a way that I think hasn't happened so much in other parts of the London integrated care space.
Thank you, Matthew. Anything you would like to add, Polly?
Just to say that the Trailblazers are kind of our first step into developing what we think will be work, health and skills plans. We're not sure what they might look like and how they will work with the Get Britain Working plans. But there's a real opportunity for us to use and test through the Trailblazers and support then the effective delivery of Connect to Work, which is obviously our substantive and longer term programme. And this for me is really about creating those business cases for future investment. And we stopped talking about funding. This is really investment. This is investing in the structures, this is investing in the systems, and this is investing in our residents and to support them to improve their health, well-being and economic resilience. So there is an opportunity, although, you know, through the Trailblazers, but our, you know, our longer term strategy for Connect to Work. So really grateful of any challenge, any support, any ideas, and, you know, I'm open. If you want to get in touch with me, then please feel free to do so. If there's anyone you think that we should be connected to, please let me know, and we will make sure that they're on our stakeholder lists. Thank you. Thanks for the opportunity. Thank you.
Thank you, Polly, and thanks again for the presentation, giving all the answers to the questions. And again, you heard Polly, so please engage. I think this is something, like Matthew said, we need really to tackle as a partnership. Next item on the agenda, we are running slightly behind, is any other business. Is there anyone with any other business? Doesn't seem to be the case. Then I have one small item on any other business, just a reminder and invitation to everyone. South West London ICP is hosting a workshop on the 17th of March to explore joint actions to support social and economic development through our anchor institutions, and all ICP board members have been invited to attend alongside other members of the South West London Integrated Care System and public sector colleagues. So we look forward to seeing you there, and we will be reporting back to the ICP at a future date. So Mike and I are looking really forward to seeing you all hopefully there. And this comes to in Roehampton, yes, at the university.
We know it clashes with Paddy's Day.
Oh, it's part of our celebration, John.
So, last item, we have public questions. There have been no written questions which we have received in advance. Is there any member of the public who has a question? Doesn't seem the case. So, which brings me to closing the meeting, more or less than on time. And thank you very much for all the contributions today, and looking forward to the next meeting, which is on the 26th of June.